Overnight, the White House released information on President Donald Trump's health. During a news briefing, the administration announced he was diagnosed with chronic venous insufficiency. This came after a medical exam. This news has prompted questions from people across the country as to the severity of this diagnosis.
9 News health expert Dr. Pyle Coley joins us now to shed some light on the situation. Thanks for coming in.
Good morning.
Good morning.
So first, what is chronic venous insufficiency?
So it's exactly how it sounds. It's a chronic condition linked to the veins that are insufficient or leaky. So let's talk about the arteries and the veins in our legs. Arteries carry oxygenated blood from the heart down to the legs, and then the veins bring them back up. So if you think about what the veins are doing in our legs, they're working against gravity. So they have these valves that are sort of one-way doors that are supposed to open just to let the blood up and then close. But as we get older, it gets really common for those valves to sort of tear open and they start becoming leaky. So after the age of 50, it's a pretty common condition. About 30 to 40% of adults will have some degree of chronic venous insufficiency.
So the why behind someone getting this is probably related to age. Let's talk about some of the risk factors here.
So age is a huge, big one. Pregnancies can cause more weight on your legs, right? Because they cause your kind of blood to pool in your legs. If you have a job where you're standing all day, obesity, being sedentary, because exercise actually helps those veins to pump that blood back and makes those valves healthier. Sometimes if somebody's had a blood clot before called a deep venous thrombosis or any other damage to the veins before, that can also make the condition worse. And then smoking is a big one.
Is it serious?
The good news, it's not at all serious. So a lot of people have it. It's really common. It's more of a nuisance. Now, having said that, if you leave it untreated, in the kind of end stages of the disease, you can start to develop what's called venous stasis ulcers. So you can start getting ulcers and skin breakdown. But for most people, kind of early in the disease, they get swelling in the legs, they get achy legs, their legs hurt kind of all day long. And this is a classic story of when people say at the end of the day, my ankles are swollen, and then in the morning, the swelling's gone because the legs have been elevated all night long. So it's more of a nuisance in the early stages, but it does require treatment to make sure you don't get to the point where you're starting to get kind of severe edema or swelling and ulcers associated with it.
Do we know why President Trump prompted some testing for this and how it's diagnosed?
Yep, so according to the White House physician, he did have some swelling in his legs. So what they did is ultrasounds of the legs. He also had some bruising on his hands. So they actually also ultrasounded his arms, because you can get this in the legs or the arms. It's more common in the legs, of course, because they're working against gravity, but it can happen in the arms as well. And they looked at both the arteries and the veins, and they ruled out any blood clots. They ruled out any problems with the arteries. They did find these leaky veins in the legs, and they said that some of the bruising on his hands could have been due to the fact that he uses aspirin, and he often has to shake hands. Also, what you see is as you get older, President Trump's 79 years old, the back of the hands is called a high traffic area, right? Because that's the area that runs into things, and the skin there is very thin. So as we get older, our blood vessels become like tissue paper. They can sort of tear really easily, especially if you're on an aspirin as well. So that can cause some of that bruising or ecchymosis that you see on the back of his hands.
You said if left untreated, it can lead to other things. So what treatment options are there going forward?
So we start usually with conservative treatment, which is a leg compression. So wearing those compression socks, which is hard in the summer, but if you squeeze the outside of the leg, it kind of helps the blood to come back up. Leg elevation can also help. Exercise helps a lot. So people that walk, their leg muscle pumps get activated to bring that back. You've heard all these people say, my legs felt like new again, the vein center ads, all those types of things. That's a procedure called vein ablation. So we have sort of two types of veins, like a superficial and a deep. So superficial is the one that leaks, so they go in and actually close the leaky veins so that you still have blood coming back from the deep system, but the superficial system, which is what's causing the symptoms, they just burn the veins, basically close it. That's called an ablation. Sometimes they'll do something called vein stripping, where they go in and actually cut out the vein itself. These are all kind of more advanced. Usually you start with conservative measures. If you fail those for 6 months, continue to have swelling and symptoms, then you think about more advanced measures. Hard to know where President Trump is in his journey, but hopefully he's wearing at least those compression socks.
Yeah, my grandfather used to wear those compression socks.
And in fact, many of us that stand on our feet all day have had a lot of pregnancies, should wear them. A lot of us have spider veins on our legs or varicose veins. These are manifestations of the same disease.
Okay.
It's just superficial manifestations. You can see them because they're right under the skin, but chronic venous insufficiency is a little bit deeper.
Have babies and you'll know all
Yeah,
about it.
Corey's like, I know all about that.
Joys of motherhood,
Oh,
right?
yeah, truly, all worth it, but wow, it's special.
Dr. Coley, thank you so much. And of course, you all at home can find more with Dr. Coley on 9news.com/Dr. Coley.